Animal-assisted therapy is growing in popularity, but not everything you see online is actually therapy. So today we're breaking down what animal-assisted therapy really is, the neuroscience behind why it works, and how to tell the difference between true animal-assisted therapy and someone just bringing their pet to work. Animal-assisted therapy, or AAT, is a structured, goal-directed form of therapy where a trained therapist intentionally incorporates a trained animal into the treatment. And it's not just having a dog or cat in the room. According to research and clinical guidelines, AAT is designed to improve emotional, social, cognitive, and/or behavioral functioning for a client. And this is important. The animal is not a prop. They're considered a therapeutic partner in the process. Dr. Chandler is one of the leading experts in this field, and she emphasizes that both the clinician and the animal need specialized training and preparation for this work. So if a therapist simply brings their pet into session without training, structure, or intention, that's not animal-assisted therapy. So why does it actually work, or how does it help? When humans interact with animals, especially mammals, through touch, eye contact, or calm presence, our body can shift in a very detectable biological manner. Research shows that interacting with animals can decrease cortisol, which is a stress hormone. It can increase oxytocin, which is a bonding hormone. It reduces blood pressure, lowers other stress-related neurochemicals, and can increase dopamine, which is a feel-good neurochemical. In simple terms, your nervous system moves from threat mode to a safety mode. If an animal in the room is calm and relaxed, your brain reads that as this is a safe environment. And oftentimes, for people who've experienced trauma, it's really hard to regulate and feel like an environment is safe with another human being, even a therapist. So having an animal that can detect all of those things and read your stress hormones, but can also communicate to you that it is a safe place, can be hugely helpful. And when your body feels safe, your brain can finally do the work of processing that trauma. Animal-assisted therapy doesn't replace the relationship with your therapist, it enhances it. Research shows animals can reduce anxiety, increase emotional expression, and help clients feel more comfortable opening up. They can also facilitate social connection and improve communication. They can support engagement in therapy. So for many clients, especially those who've experienced relational trauma, the presence of an animal creates an additional non-judgmental relational bridge. In relational cultural terms, it helps create what we call a growth fostering connection. So sometimes before words are even possible, we can read what the animal is putting off and trust that relationship. Research shows that AAT can be helpful across a wide range of populations, including those struggling with trauma and PTSD, anxiety and depression, children, adolescents, autism spectrum disorder, survivors of abuse, older adults with dementia. There's also evidence that it can reduce internalizing symptoms like anxiety, it can improve emotional regulation, and it can support social functioning. Oftentimes, the animal can sit in as a new form of growth fostering relationship. And you experience that in your body when you're in the room with them. There is some nuance, not so much about the diagnosis as what that individual client needs relationally. So, clients who struggle with trust, emotional safety, verbal expression, shame, fear of judgment often benefit the most from animal assisted therapy because animals don't judge us, and we know that. As much as a therapist might tell their clients that they are non-judgmental, it can be really hard for people to truly trust that without spending significant amounts of time with that therapist. And sometimes that amount of time can impede the healing process. So having a truly non-judgmental animal in the room can help speed a lot of those things. This is the part that doesn't get talked about enough, in my opinion. The animal is considered a therapeutic partner. That means their needs, their boundaries matter just as much as the client's. So, to practice AAT ethically requires respecting the animal's autonomy, watching for signs of stress or fatigue in them, and allowing the animal to choose to disengage at any time. Research highlights that therapy animals must be properly trained, carefully selected for having the right temperament, and able to tolerate the therapeutic environment. There might be times when clients are crying or need to yell, and they need to be familiar with that. Also, you're going to have clients of all shapes and sizes, and your therapy animal needs to be prepared for that and not dysregulated by it. If a therapy dog, for example, wants to move away or take a break or take a nap, they need to be allowed to do that. Because ethical therapy is not just about helping humans, it's about not harming the animal in the process. It should be ethical for all participants. So, if you're considering this type of therapy, I'd encourage you to ask a few questions, such as, what training have you and your animal completed? Is your work structured and goal-oriented, or what would be the goals around bringing in this therapy animal? How do you monitor the animal's stress and well-being? And how is the animal truly integrated into the therapeutic process? And if any of those answers are unclear, I would consider that a red flag. Animal-assisted therapy isn't just about comfort, even though that's important. It's really about connection, regulation, and relational healing on a biological and emotional level. And when it's done well, it can create a kind of safety that words alone simply can't always reach. So, I hope this was helpful to you. If it was, please let me know. And don't forget to like, subscribe, and share this with others. Thank you.